CBS News has learned that the CDC is considering protocol changes for protective gear. More about that now from Chief Medical Correspondent Dr. Jon LaPook in Washington.
Currently, this is the level of protection required. It has one layer of gloves, fluid-resistant gown, eye shield, and face mask. Many in the healthcare community feel this is an inadequate level of protection.
I think the CDC and everyone has been naive and a little ill-prepared in getting a hold of this. We've never had an agent this infectious and this risky.
Dr. Bruce Farber is head of infectious diseases at North Shore LIJ Hospital, where they are prepared to use a higher level gear. It includes a hood, leg, and shoe covers. The CDC said the use of full-body suits, like those used in West Africa, is also under consideration. Sean Kaufman trained healthcare workers at Emory University Hospital when two Americans, Dr. Kent Brantley and Nancy Wrightbull, were treated there this summer. He is now doing infection control in Liberia. He says he's been warning the CDC that the guidelines were irresponsible.
When you look at what CDC is recommending for what clinicians should wear when working with a patient with Ebola, it's really literally unbelievable, because a patient can produce high quantities of very, very virulent fluid, the fluid that can spread the virus in very unpredictable ways. To me, it makes no sense.
Kaufman says equipment and training aren't worth anything if the gear is not safely removed, and that takes training, lots of practice, and much supervision, or it's like not having any protection at all.
John, there was some video yesterday of the transfer of the second nurse, Amber Vincent, and there is a man near the plane not wearing any protective gear, which would appear to be a breach of protocol. What have you learned about that today?
Well, I actually initially thought it was a breach of protocol too, jumping to the wrong conclusion, but I spoke to that man with the clipboard. It turns out he's a physician, and he was following protocol. He is the eyes and ears on the tarmac, because the people wearing the protective equipment, they don't have very good peripheral vision. And so this is Phoenix Air, and they've transported 11 patients with Ebola. No healthcare worker has been infected. And so it shows you if you do follow protocol, you can protect the healthcare workers.
Dr. Jon LaPook in our Washington newsroom. John, thank you.